It's my pleasure to introduce Elizabeth today. She's been with Emerald for approximately 5 years. Apparently, this is just rumored, that you are the silver medal winner of the SIT, the health SIT. She, as part of the Emerald Physicians Health Fair and Olympics, she not only sat in the position against the wall for 8 minutes and 45 seconds, but rumor is she's also lost 65 pounds. You go, girl.
Yes, that's true. I am the great sitter, so but and I have lost about 65 pounds over the last year after the birth of my son in February of last year, who's sitting right there in the middle, and my daughter Julia. I decided to take control of my life. I had been overweight even before I had had my children, and so I spent the last year, a little over a year, changing my diet and moving a lot, dancing and doing the right things. So today is an important event for me too, because it's helped to change my life as well. So I'm here today to talk about vitamin D and why it's not only beneficial, but it's essential. And we've heard a lot about vitamin D in the news and its importance in bone health, and I wanted to talk more about vitamin D today and the other things that it can bring to the body. So what is vitamin D? So vitamin D is a fat-soluble vitamin. It is stored in the liver and fatty tissues, and it's absorbed in the gut. And the daily requirements are measured in international units. So when you see supplement bottles at the pharmacy, you know, we're used to seeing milligrams, micrograms. IU, international units, is what you'll see for vitamin D, so something a bit different. So some of the functions of vitamin D. So as most of us probably know, but vitamin D helps with bone strength and the mineralization and the growth of bone, help to keep our bones strong. And also helps the body to absorb adequate amounts of calcium to keep your bones strong as well. But it also, which you may not know, it plays a role in neuromuscular and immune function, as well as the reduction of inflammation. And also, many genes that regulate cellular development are modulated in part by vitamin D. So its functions go beyond what we just may know is for bone health. So vitamin D is known as the sunshine vitamin. That's an easy way to remember it. And most of us will get the adequate amounts of vitamin D that we need just through sun exposure. So the body makes vitamin D with exposure to sunlight, and what a medium skin-toned individual will need is about 10 to 15 minutes of sun exposure 3 times per week. And that would be enough to produce the body's vitamin D requirement. But of course, there are some considerations. So that is really direct, bright sunshine, like on a day like today. But of course, season and shade, smog, climate are all going to affect that. And those things that cause the sun to be not as brilliant will require you to stay out in the sun a little bit longer. Also, for certain skin types, which darker skin types where the melanin content is increased, melanin, which makes the skin dark, actually is a skin protectant against UV rays. So people with darker skin will need a longer exposure as well. So this is just a little brief diagram about, you can see from the sun, how that UVB radiation coming from the sun hits your skin and allows your skin to synthesize vitamin D. And then the synthesis that happens from sun exposure, you can see that once it is made in your skin, that it's carried through the blood to the liver where it's stored, and then the blood will also send it to the kidney to activate vitamin D so you can use it. Oh, that would really be great. Little pincher. Thank you, Dr. Siddhartha. Haha. So you can see right here, so the liver where it's stored, and then when it's needed, it's activated. The blood will send it here to the liver where it's activated and used in your body. Okay, but of course, when we're talking about sunshine, there's an important reminder for skin cancer. So UV radiation, although beneficial and allowing your body to synthesize vitamin D, can cause skin cancer for overexposure. And there's, as we says here, there's 1.5 million skin cancers diagnosed annually in the US alone. But because of public health concerns, there are no formal studies on whether the synthesis of vitamin D from ultraviolet rays can happen without increasing the risk of skin cancer. So they're not going to obviously put participants through overexposure for the risk of skin cancer. So bottom line is continue to wear your sunscreen, okay? Vitamin D is important. So here are some dietary. So we talked about getting it from the sun. That's the first way that we get our vitamin D, through sun exposure. The second way, the natural way that we get vitamin D, is through our food or dietary sources. So the easy way, I have a couple slides on this, but the easy way to remember it for me anyway was through fish and dairy. And so you'll see these things up here. You can read them there. And I think the one to me point out was that it is in all milk, because all milk in the U.S. is fortified with vitamin D. But you can see here cheese, butter, cream, fish, oysters, margarine, and some cereals. Orange juice as well. Some orange juice are fortified with vitamin D. And this is just a prettier diagram that says the same thing, but you can just get that idea, the sunshine and these dietary food sources. Okay, so the recommended daily allowances of RDA. So these sources are from the National Institute of Health and the U.S. Department of Agriculture, which recommends, to simplify the site even more, that really males and females will have the same recommended daily allowances from it's actually age 1, but I thought for today we'd see from age 14 to 70 is about 600 international units per day, which is equivalent about 15 micrograms. For males and females over 70, that RDA will increase to 800 international units per day. And again, this is the recommended daily allowance for people who do not have deficiency or do not have any disease state that would, have them require a higher vitamin D intake in their day. Think about your own diet, that some of the food sources that I talked about, again, that fish and dairy, some of the food sources that I talked about, here's the actual international units that are in these foods. So I don't know how many of you eat cod liver oil by the tablespoon, but I just thought it was such an impressive international unit, so I put it on there. But you can see the things where you see the fish here, even salmon, 3 ounces alone will have, about 450 international units. And remember, if your requirements are 600 or 800 a day. And then here, milk, all fat, so non-fat to whole milk. 1 cup will have about 120 international units a day, and that's about 2,000 international units in a gallon. Let's see that down. So here, I thought it was important to mention too that there's some cofactors here for vitamin D, and these compounds right here, taken in the diet, will help to activate and augment the way that vitamin D works in your body. So taking them as a part of a healthy diet will just complement the activity of vitamin D in your body. You can see here magnesium and some of its dietary sources, zinc, king crab and pork tenderloin shoulders, and boron and seeds, nuts, berries, honey, and vitamin K, which I'll talk a little bit about. And I think the overall message here is, eating well. These are all things that, nuts and berries and fruits and vegetables should all be, included in a healthy diet. And vitamin K, I have on a future slide that we'll talk in a little bit more detail, but vitamin K, which you get primarily from green leafy vegetables for the simplicity of the slide, but vitamin K is actually also good for bone health as well. It's going to activate bone proteins to keep bones strong. And it will also, as you see right down here, regulate the function of calcium in the bone. But what we'll talk about, like I said in a few slides, is that vitamin K will also inhibit vascular calcification. In other words, the calcium that comes into your body that vitamin D helps to absorb, taking vitamin K or having it as a part of a healthy diet will make sure that that calcium gets to the right place. And then we'll talk a little bit more about that in a second. Okay, so we talked about sunshine and we talked about food, and then this is the third way that we can get vitamin D, through dietary supplements. So if you're in the store, you'll see that they're probably going to see two different forms of vitamin D, D2 and D3. And really the only difference is where they're derived. D3 derived from either lanolin or cod liver oil extract, and vitamin D2 from fungal sources. But really, the literature just says that they're pretty much equivalent in the treatment of deficiency because they have a similar metabolism and method of action. So this is the upper intake levels of supplements now. So usually we talked about the recommended daily allowance was 600 to 800 international units. This is really the upper level of supplementary intake. But no one should be taking these levels in supplement without consulting with a healthcare provider. I thought interesting to know that, when people who are prescribed this for deficiency, that these levels are quite normal. And in fact, toxicity is much further beyond that. People can take tens of thousands of international units before they hit a level of toxicity. Not recommended, obviously, if you're doing this on your own. But as your healthcare provider prescribes this to you, if you do have a deficiency, just know that those are, the upper intake of normal. And another important thing on this slide is that excessive sun exposure or getting vitamin D from your diet or food sources will not result in vitamin D toxicity. You cannot, sit out in the sun all day and worry about this. But some symptoms of the toxicity of vitamin D: weight loss, heart arrhythmias, vascular calcification, and an increase in all-cause mortality. So it can be very serious. So when we talked a little bit about that vitamin K, where I talked about the vascular calcification, found this very interesting because I had actually heard this in the news quite recently, where we heard that vitamin D was so good for you, and then there was some news out that, oh no, maybe it's not that good. And this is about this slide. So if you did hear something on the news recently about that, this is addressing this. Basically, where we talked about that vitamin D helps the body to absorb calcium. Well, if you absorb too much calcium because you have an excess amount of vitamin D, it causes high levels of calcium in the blood. And so high levels of calcium in the blood can lead to calcium deposits in soft tissue, or calcification, hardening of the soft tissues. And these soft tissues can be found in the heart, lungs, blood vessels, kidneys, all very important essential organs. And so that report that came out recently was addressing that high levels. But like these levels, you will not achieve these levels through sun exposure and diet. This would be through supplementation. So your healthcare worker will work closely with you to make sure this doesn't happen. And there are a few diseases that can cause excess vitamin D, like sarcoidosis, but in general, this isn't going to happen with a recommended daily allowance intake of vitamin D. But you can see down here with vitamin K, it counteracts that right here. I know it's kind of small because I was going to talk about it, but that this vitamin K ensures that the calcium, instead of being excess calcium in the blood, actually makes it to the bones. So you might see some supplements. I know Viactive has one brand that will have, a Viactive brand has, one product that they make that has vitamin K in it as well. So some interactions, vitamin K with other medications. And I know there's a lot on here because the bottom line is, if you're starting a vitamin D supplement, please talk with your healthcare provider. So, and there's this research, this information rather, is pretty much from the National Institute of Health. University of Maryland Medical Center had some information as well. So, but this is information that your healthcare provider will be aware of. But you can see here that, and some of these interactions are functional interactions in that, they'll impair, reduce the absorption of vitamin D rather than have, some chemical reaction. But I think the important ones here are these weight loss drug medications, Xenical and Ali. They reduce the absorption of vitamin D because what you're doing is, we talked about, because it's a fat-soluble vitamin and it's absorbed in the gut, if you are taking medications that mess with the fat absorption of your stomach and your gastrointestinal system, it's going to affect your ability to absorb vitamin D. The same thing is true for these cholesterol-lowering drugs. You can see here, Questrin, Locolest, and Prebolite. Let's see, what other ones to mention here? So antacids for taken for periods of long periods of time can alter the levels and metabolism of vitamin D. And this is important too. The thyroid diuretics is popular medication, water pill frequently prescribed for high blood pressure, hydrochlorothiazide, can increase the activity of vitamin D and lead to inappropriately high levels of calcium in the blood. So we talked about that calcification, especially if someone's taking it for high blood pressure. So just stuff to be aware of. So coming to the end here, vitamin D deficiencies. We talked about excess, so here's deficiency. So deficiency can cause several conditions, most commonly here osteoporosis, which is porous, brittle bones, osteomalacia, soft, weak bones, and rickets in children, which is more rare since milk was fortified in the 1930s. Okay, so who are the populations that are at risk for a vitamin D deficiency? Well, older adults are at risk because they cannot synthesize, their skin cannot synthesize vitamin D as well. They also tend to spend more time indoors. It was on a previous slide, I think I forgot to mention that the UVB radiation that is needed to synthesize vitamin D does not come through glass. So sitting by a window or sitting in your car would not be enough for you to make vitamin D. Obviously, people with limited sun exposure. People with dark skin, we talked about that because the melanin content of the skin. People with fat malabsorption, so remember we required dietary fat in the gut to absorb this fat-soluble vitamin. So diseases like liver disease, cystic fibrosis, Crohn's, anyone with a bile deficiency, which will help the breakdown of that fat-soluble vitamin, or celiac disease. And this I found very interesting. People who are obese will have a greater amount of subcutaneous fat under the skin. So as you get sun exposure and the synthesized vitamin D, that subcutaneous fat will absorb the vitamin D and not allow it into the bloodstream to be used. So I thought that was interesting. And finally, people who have undergone gastric bypass because the upper intestine, where vitamin D is absorbed, is bypassed in that surgery. Certain diets that may be prone to a vitamin D deficiency, and we're talking about fish and dairy, so people with milk allergies, lactose intolerance, or lacto-ovo-vegetarianism or ovo-vegetarianism and veganism, just because if they're out in the sun, they should be fine if they're healthy individuals. But if you're talking about dietary sources, this may limit the amount of vitamin D. So is there a test for vitamin D? The answer is yes. There is a serum test, a blood test for vitamin D, and it's called the 25-hydroxy vitamin D right here. And that's the body's main storage of vitamin D. And so, this is a conversation to have with your healthcare provider if you need this test, but I would tell you it is a very expensive test. And it's not recommended for routine screening. But with the discussion with your healthcare provider, if it's determined that you're at risk for a deficiency, it's an essential test. But it's not part of screening unless you're looking every 5 years or something, just because of its cost and value if you're a healthy individual. But these are the results right here, where you can see a result under 20 is a deficiency. A result from 20 to 30 is inadequate for bone and overall health. Over 30 is adequate, but a result of 50 or 80 is actually optimal. So why is vitamin D essential? We talked about osteoporosis. 40 million people in the United States have or are at risk for osteoporosis, which, as we discussed, is low bone mass, porous bones, or deterioration of bone tissue, which puts you at risk for fracture. So adequate storage levels of vitamin D will maintain bone strength and help to prevent osteoporosis. And vitamin D helps with the absorption of calcium to keep your bones strong. A bone mineral density test, that BMD, will actually take a look at your bones to see if they are if there is osteoporosis or osteopenia, the development of osteoporosis, if the bones are brittle or porous. And this is recommended for people 65 years and older in general, or people who have risk factors. And in general, it's done every 2 years or is recommended. And we do them at Emerald Physicians. So osteoporosis, your body's constantly making new bone and breaking it down or reabsorbing it. And when you're young, this process happens very quickly. You make more than you lose. But in your mid-30s, can you believe it? Your body continues to make new bone, but more slowly, so you're losing more than you make. And this is just a quick diagram about age. It's kind of sad. But you can see right here, over the hill. It's like, we're all over the hill. But you can see here that right around 30, it starts to decline. And for women, you can see right here, right about the age of menopause, around age 50, just plummets down there. So that's kind of a depressing slide, but it's all about information. So osteoporosis and vitamin D. And then I also just briefly wanted to just talk about cancer prevention. So there's emerging evidence that vitamin D status will affect your cancer risk. And they're linking vitamin D to a role in prevention of colon, prostate, and breast cancers. So, and research is ongoing. There's also research suggesting that vitamin D may play a role in the prevention of treatment of these diseases as well. Diabetes, hypertension, MS, Parkinson's, chronic pain, and depression. But of course, more research needs to be done. Okay, and this just briefly shows this similar to the previous slide. Instead of by disease, it's by organ or system. And that it's, we think of vitamin D as for bone strength, but it's for a lot more. It affects our immune system and our endocrine system and much more. So this is the little cartoon here where the pharmacist, this woman's looking at the whole long line of vitamins, at the store, and the pharmacist says, feel free to ask any questions because the world of vitamins can be complex. But it's actually, at least in the world of vitamin D, very simple. It's get out in the sun, eat well, and you should be fine. And then if there is a risk of a deficiency, talk with your healthcare provider. So this is the overall message, which is simple. So get out in the sun and eat well. That would be Viva Cape Cod, because there is a lot of sun, especially now. And Viva la cuisine, and Viva vitamin D. So for Viva Fest. So thank you very much for your time.